All right. Well, good morning, everyone. Welcome to day four, our final day of the CRIO Partner Expo. I'm Nikki Gandhi, the Associate Director of Community Engagement and Head of the Partners Program at CRIO. If this is your first session joining us, a quick orientation. CRIO is a site-first eClinical platform, and the Partners Program is our curated group of 32 and growing vetted site tech and service vendors who plug directly into CRIO to fit seamlessly into our site workflows so they can perform more efficiently, effectively, and compliantly. And that's exactly what today's five sessions are going to show you. For everyone who has been with us since Tuesday, Wednesday, and or Thursday, thank you so much for tuning in and welcome back. We're glad to have you. We've had 4 days, 22 sessions total, and today we are bringing it home. But here's what I love about today's lineup. AI has obviously been a recurring theme throughout this webinar. And today we're going to see three new AI-driven solutions, and we'll also see a session specifically for research naive and rural sites to be able to grow. And we'll see our first partner in the implementation support category. So lots of new and exciting things on the docket today. I'll pass it to my colleague Nuha to preview the agenda for the day.
Thank you, Nikki. Can everyone see my screen?
Yes.
Perfect. Welcome to day four of the Partner Expo. Today's lineup is all about turning data and AI into a real competitive edge for your site. We'll start with BEKhealth, who will show us how automated chart reviews can surface best fit patients straight from your EHR, no added coordinator workload. From there, Todata Analytics will walk us through how they unite accounting, operations, and CRIO data into one real-time source of truth for better site decisions. We'll then hear from Srotas Health on the full AI-powered patient journey from study feasibility through recruitment expansion on channels like Meta all the way to patient conversion. Next, E4Health will cover the implementation methodology and project management support that helps your CRIO rollout or expansion land the first time. And we'll close the day with clinical science research solutions, looking at how accredited workforce development and AI-powered simulation are helping community and rural sites build sponsor-ready teams and compete for more studies. And then Nikki will go ahead and introduce our first session.
Yes, thank you. One really quick thing, you guys in the audience, I want you guys to hold on to something as you're moving through today's sessions. Think about what data your site is already sitting on right now, and are you using it to the best of its ability? Chart data, feasibility data, financial data, capability data. By the time we close today, I hope that you'll have a clear next step for putting at least one or hopefully all of those to work. Some housekeeping reminders. We have 5-minute breaks between every session. Drop your questions as they come up in the chat. That is the beauty of this being a live webinar. And at the end of each session, there will be a poll. Let us know if you want to learn more about the partner or want to just stay in the loop or receive some of their resources. If a session hits home, again, don't wait to reach out. Indicate it in the poll at the end of each session, please. Or we can absolutely, as the CRIO Partners team, connect you with that partner. Again, every partner here is in the CRIO Partner Directory if you're a CRIO user, and that is a super easy way to get in contact with them after this as well. So let's jump into our first session. I'd like to welcome Dave Levin from BEKhealth to kick us off today.
Wonderful. Thank you. I appreciate the opportunity. Wonderful event to showcase us as a company and your other partners. So thank you. I'm gonna share a PowerPoint only to guide the discussion since we only really have 15 minutes. So I'm gonna just open that up and then I'm gonna talk a little about that. Everybody see my screen, I'm assuming?
Yes.
Awesome. So as Nikki had alluded to, we fit squarely in sort of the top of the recruitment funnel for our customers, where we're helping our site networks, both big and small, really leverage the data that's already existing within the network. You guys do the hard work of building the network and the partnerships with local practitioners that help you in that research. And we help facilitate your understanding of the population that you have available to you, and then ultimately identify patients that would be a good fit for the research that you're conducting. We are finishing our fifth full year in business. We're one of the older players in this sort of new realm of using AI. We have been using various machine learning techniques and AI since the company founding and since we went to market in early 2022. We have about 50 customers, most of which are site networks. I'd say about half of our customers are large national players, some of the largest site networks in existence today. And then the other half are owner operators, regional players with maybe, a handful of healthcare practitioner partners. What we really do is we help you eliminate the need to do manual chart reviews across your ecosystem of healthcare partners. Many of you are very familiar with the burden of logging into, or God forbid, driving to a practice and having to log in on site, the EMR. We try to eliminate sort of that burden from you and help you aggregate all of that data across your ecosystem. We do that by connecting into the various EMRs. So right now, we believe we have one of the largest EMR libraries and what we call adapters that represent about 85% of the market. We have just north of 40 different EMR adapters from the big guys at the hospital systems, Epic and Cerner, all the way down to eClinicalWorks. And, we're just finishing up. We're working on three new adapters for some of the smaller ones, Practice Fusion, et cetera. So, there's lots of different adapters that we continue to work on. One of the things that's unique for us is that once we put our adapters into place, if you will, the piping, the plumbing, we get real-time feeds every day. So we're pulling data every day. So you have the confidence that the data that you're looking at within our BEK platform is as current as yesterday's encounters amongst your network. We are very focused on community site networks and community practitioners. We made the business decision to focus on, again, community site networks, research networks that are working with, primary care practices, specialty practices, and working outside of academics. So our focus is solely on sort of community practitioners. What I like to say, people who are in the business of running research. The obvious benefit to you all is faster identification of patients that you can get to, those folks on a timely basis so that you can begin and work them through the recruitment process that much faster. We all know the burdens of having to look through, a 100-page medical chart, and we hope to eliminate that for your site coordinators, your research coordinators. One of the added benefits of working with the BEK platform, so we offer two solutions to the marketplace. The BEK platform, which is the genesis, the core of our business, is the technology platform that we sell to site networks. We plug it into your network. You start extracting data out of that network for patient matching, feasibility analysis, all the things that I just described earlier. But one of the things that makes us unique is what we call the BEK network. That is all of our customers, and this is an opt-in program, explicitly allow us to use their data for feasibility to work with pharma and CROs directly. So not only are you using our technology to optimize your own workflows and your own business, but we have the opportunity in BEK working with sponsors and CROs to bring opportunities to you. So just today, we literally got a request for information from Pfizer. It's not uncommon for us to get a protocol from a large pharma or CRO to say, I need patients that look like this. I know you have a large network. Can you help me identify sites that have patients that meet these particular inclusion exclusion criteria? For those of our customers in the BEK network, we run a query, we provide aggregate blinded data back to pharma, and then we essentially broker the opportunity for you. And so once we tell you that there's an opportunity, you decide if this is a good fit for you, then we match make, and then we support the sponsor in activating their protocol within your environment. They pay us directly. You get the opportunity to be activated as part of that study because they know in advance that you have the patients that they're looking for. So that's a great opportunity. It's one of the unique aspects of our company. One of the more exciting developments within our company is our expansion into supporting real world evidence research, so observational research. So not only uh, would we be able to bring you interventional research, but now through our work, on the sort of post-approval side, observational side, we can bring you real-world evidence research that is a little lighter weight than a clinical trial, but nonetheless, important part of the whole ecosystem. So we're excited about that particular opportunity as well. And that's just you being part of the Beck sort of family, if you will. Like many of the other players that you've probably heard from, we connect directly into the source systems. We process all of that information. So we extract both the structured, unstructured clinical notes, documents, etc. That makes up the medical chart. We run it through all of our transformations so that we organize it across these various, what we call domains, so that at the end of the day, everything, regardless of where it's coming from, is put into a common data model so that you can search across your network in one tool and find out exactly where your patients reside, what they look like, are they a good fit for whatever studies that you're looking to enroll. And so once we transform out all that data, we apply our intelligence, which is the AI. We use an ensemble approach of natural language processing where we pull out medical concepts and medical facts from the unstructured text, as well as large language models to help with our matching accuracy so that we are delivering to you the best fit matched patients available within your network. And then, of course, on top of all that data is, we offer support to pharma on protocol design, certainly research feasibility, site selection, as I mentioned earlier. But if you're a larger network, you have lots of sites. Not all the sites are a good fit for the research that you're pursuing. So it allows you to decide which of the sites within the network are a good fit for whatever research. And perhaps most importantly, it helps you figure out which projects that you're not a good fit for. So it starts with the population, and then we go from there. Any questions, comments? I know we have about 5 minutes left. I wanted to leave at least 5 minutes for any questions. And the most important thing I just forgot realizing is that all of this, the match list, then gets inserted programmatically into CRIO. So that's really the end result. So if you're using your CRIO system to support your recruitment workflows, you don't have to, manually export the data out of our system and then import it into CRIO. We do that automatically for you so that your teams that are used to using CRIO, that's the tool they use. So think of this as just another uh, facility for helping you with referral management. The list that comes out of your EMRs is a clinically eligible list of patients from within your own network, and it shows up in your CRIO instance for you to sort of validate and then activate.
Feel free to drop any questions in the chat as they arise. Really quick, David, you're kind of alluding to it there at the end, but for those PIs who might be apprehensive of having you guys get into the
Right.
EHR. I've been a coordinator. That is definitely a hard discussion. What are maybe a few bullets that, coordinators
Yeah,
can
yes, of course. We are in the business of managing other people's data, particularly PHI. We take that responsibility very seriously. We provide all of the expected governance, security controls. Um, we've gone through vendor qualifications and audits across the board from small organizations to very large. We just finished a vendor qual with Icon, so we're very comfortable. Um, we are SOC 2 compliant. We clearly follow HIPAA. We also operate, there's a very explicit clause within HIPAA that allows for the use of PHI in identifying potential research participants. That's referred to as preparatory to research. And given that you're researchers, we fit directly in that clause that allows us to interrogate the data to uh, to assist you in finding the perfect fit patients. So uh, typically, once we explain sort of how we go about things, it allays some of the concerns. Um, you know, like I said, we have about 50 customers. We're working with well over 250 clinical research sites across the country. We are managing over 20 million patient records every month, and about a billion plus actual encounter and clinical data points. So we're one of the oldest players in the space and gotten to a certain scale for sure.
What does that implementation actually look like? What is
Yeah,
needed from the site to get you guys in there into the
yeah,
EHR?
great
How long
question.
does it take?
So in general, the implementation across all of the EMRs that we have adapters to is 4 to 6 weeks. That's broken into sort of three main areas of activity. There's the authorization and approval that the practice goes through with their EMR vendor. That's first and foremost. Every EMR vendor has a different approach. Athena is probably the easiest. It's an online form. Once that's approved, the data starts flowing. So we'll walk you through that process. And then once we have access to the data, we start extracting data, processing it, transforming it, and then the last component before we go live with your data is the QA. We have a team of research nurses that inspect the data, make sure that it's in the shape that we expect, and then we go live, and then that same team of research nurses is available to help you. Um, that's a really important team because they are your support. They're not just technical, but they're clinical support. So many of our customers submit their protocol to us directly, and then we build and activate that protocol within your environment so that you don't have to be burdened with having to do that work. And that's usually about a 2 to 3 day turnaround.
Great. Thank you. If you guys do have any questions, continue to feel free to drop them into the chat for the next few minutes and throughout the break. But please do take the poll. Let Dave know if you'd like his team to reach out to you, or if you'd like to stay in the loop or receive some resources on their services. Please indicate that. And then we will go into a short intermission. Thank you so much, Dave.
You
We'll be
bet.
back at 11:25 Eastern, and then we'll hear from Todata during our next session. And
Thanks
then
everybody for the opportunity. I appreciate it.
thank you.
All right.
All right, moving along to our next session. We have Stephanie Anderson, COO of Todata. Steph, I see you. You're on. Great. And feel free to take it away.
All right, thanks so much. Good morning, everybody. My name is Steph Anderson. I am the Chief Operating Officer at Todata Analytics. And before I came to Todata, I was actually in the clinical research industry for about 8 years. So this is an industry near and dear to my heart. But because of that, we built a product specifically for clinical research sites. It's called Site Grades, and I'm going to show you a little bit of that today. And it was really built as a solution to a lot of the problems I think are shared among those of us running clinical trials, and that we have this amazing data that's living inside of CRIO. I mean, there is such rich information in there. I mean, every visit, every screen fail, every contracted target, all the budget information per visit. The data is not the issue. It's all in there. The hard part is really how do I get it out in a form that I can digest and I can act on? So, and can I act on that fast enough to actually make a difference in my organization? So I think a lot of times what folks are doing today is exporting that data, maybe putting it into a spreadsheet, transforming it in some way that can be shared in a group by an individual or in a group setting. And there's usually a lag in time for that, right? Maybe it's weeks, months, quarterly. And by the time you make sense of that information, are you acting fast enough to really make a difference? And so that's really what we set out to solve as part of our partnership with CRIO, is extracting that data and modeling it into something that you can make sense of and make decisions in your organization. So without further ado, I know we're on short time. I'm going to share my screen here and pop in and show you a little bit of this tool. Oh, wrong one here. Sorry. Let me get to the right window. Oh, sorry, guys. I think I'm getting the wrong window here. Share the screen. Okay, I think everybody should hopefully be able to see that now. So as you can see, there's a lot of information going on here. There's a lot of different reports I can click through at the top, but in the essence of time, I'm just going to pick a couple that I think might be most relevant. So what I'm defaulting to here is our trials page. And what we're doing is taking information directly from CRIO related to the studies that you're running. And so in this instance, this is where I see our research sites really deriving the most operational value, because we're pulling in all the information on your trials and organizing them in a way that you can make sense of. So I'm going to just click into one trial here so we can kind of take out some of the noise. I'm going to look at this Merck trial. And I'm going to first point you to this metric called a pace ratio. There's so many questions we want to ask about our trials that should seem easy to answer, but they aren't always. Like, how much time do I have left to enroll on this trial? Am I on track to meet my enrollment goals? How am I doing if I have multiple sites on my performance on the same study across multiple sites? So in this instance, if we're going to look at this Merck trial that's running at 3 different locations, as long as I've got a green light date, enrollment end date, enrollment goal, which all exist in the CRIO data set, everything that you're looking at here is in the CRIO data set. As soon as you start and as soon as you enroll your first patient, we can calculate this paced ratio. So simply put, if you've got 10 months to enroll 10 patients and you enrolled 1 per month, you'd be at a paced ratio of 1, meaning you're on track. If it's higher, that means you're running slow. So if it's a pace ratio of 2, you got to pick up your pace by go twice as fast to meet your enrollment goals. And so once we've got that number, we can provide all these other KPIs that really help you make decisions about which trials need attention, where to spend your time, how much revenue is associated. So in this Merck trial example, we can see that based on our current pace ratio, we would need to enroll 16 more patients per month to meet our enrollment goal. And because we can calculate your screen fail rate, we know that that means in this instance, high screen fail rate, you'd need about 40 screens to equal that enrollment target. And so because I'm clicked on Merck, let me just unclick on it for a second. You can see all these filters, of course, or all these visuals will change, but I'm going to click back just to make it a little more digestible. based on our current pace, we could expect to enroll an additional 51 patients in this trial. That leaves 45 at risk. So the associated revenue with those 45 that are at risk is just shy of $700,000. So I'm sure you can all relate. The business development part is hard. Study startup is hard. And so anything that, we can do to help you enroll more participants in an existing trial is often a higher, you're going to gain a little bit more profitability from that. So there may be things that your sites, if you have multiple sites, can learn from each other. Maybe one is enrolling really ahead of pace and one's a little bit behind, and they can share best practices because at a glance, you can see who's doing well and who's a little bit behind. So just at a glance, so much information here to gain on this trials page alone. So I'm going to zip over and show you another view. This would be our finance page. And so I'm clicked in on this year. You can change this date context or even add a date slider. And again, this is just the financials coming straight from CRIO. You could add another data source like a P&L if you wanted to get more granular expenses. But just with CRIO data set, you're going to get a pretty rich view of revenue earned, plus a little bit of a forecast. So I can look here and see that we've earned about $2.5 million so far this year. And then I can go and see what we have scheduled. So if we've enrolled a participant and we know they're on the schedule for a follow-up visit, or we have, entered all of the visits that are in window, I can see what kind of revenue we're expecting for the rest of the year. So this is a really perfect demo data set that would never exist in real life, where you've actually scheduled all of your in-window visits for the rest of the year. That would be amazing, but probably, your coordinators are scheduling 1 or 2 visits out, and there's 6 months of additional follow-up visits that you'd want to see. So we can get a good sense of what revenue we're going to earn based on the folks that are already enrolled in our existing trials. And then I can flip between. This again is a view looking at trials, but if I want to look at that by site, or maybe I'm going in and trying to negotiate more of a strategic relationship with a sponsor, you can slice this just with a click of a button to transform this in whatever context makes sense for you. Okay, let me pop over to one more that I think will be beneficial to this group. I'm going to look at the recruitment tab. So recruitment's another one where the pathway to the patient is so challenging, and most folks are just heads down trying to find anywhere they can to get these participants in trial, but you don't always know, what's working the best. And so when you're entering this data into CRIO, we can slice it up so that we're looking at an aggregated view across all sites, across all trials right now. But if I just wanted to look at a certain trial, I can do that. So at our aggregated site, we can see that our top referral sources kind of vary. Some of our recruitment partners here, some social media, a little bit of local newspaper. I doubt in reality that would ever be that high. But if I want to go in and look at a specific trial and see where our patients coming from, I could take a peek at this AstraZeneca type 2 diabetes trial. And all of a sudden we see, the makeup of our referral sources is quite a bit different here, that this is a lot of referrals, and about half referrals and about half social media. Conversely, I can take a look at a particular site. If I wanted to see Charlotte and where their referral sources come from, again, we see maybe these are PIs and it's embedded site, or maybe these are a doctor referral program that you would have set up. And that's driving a lot of the participants in at this particular site. And so then, of course, because I've selected Charlotte, I can see what our recruitment funnel looks like, what are our conversion rates. I can see over time how our outreach has impacted randomizations, and all just really easily at the click of a button. So again, there's a lot I'm leaving out in this demo, but I do want to point you to something else in the tool that's become really handy. Many of you may have had experience with consuming data in this way, these curated visuals. We didn't feel like that went far enough, because often what happens is you get in here, you see something that looks interesting, right? I'm interested in this Merck trial. and then you have more questions. Well, you know, usually what you would have to do if you'd built a tool like this is you'd say, hey, go back to the developer. Now I really want to see this chart or graph. You got to wait time. It costs money to build it. And there again is your lag. So we wanted to eliminate that lag and you being able to drill in further. And so we added our AI agent, Todd. So we curate this data model for you based on your CRIO data set. And then we train Todd on the same data model that's populating these visuals. And so, if anybody's used an LLM before, Claude or ChatGPT, you get a lot of instructions about prompting skills. We try to make it pretty simple. So Todd knows I'm on the trials page. Todd knows I'm clicked on Merck. So I could literally ask something as simple as, what's going on here? Not a very sophisticated prompt. And Todd's going to pull that context through and allow you to just start interacting with the data in whatever way makes sense to you. And that could change wildly if it's a coordinator or a site director or a CFO or a CEO. You're going to interact with this information in different ways. So now you can start to curate based on your own role and your own interests. And Todd's going to give me this information. And I'll show one other way to interact with Todd. If I click here, let me start a new chat. Now I'm asking Todd anything about the entire data set. And I can pin chats that are meaningful to me. So I'll just pop over to one that I asked recently. I wanted to know about our enrollment trends over the past 2 years. So I asked Todd that question. Todd gives me a nice little narrative and then proposed a chart. I like to consume by charts, so I'm just going to click on that. And now I'm getting my own personalized chart based on my question of the data set that's showing me these trends over time. And maybe I want to take that into a team meeting or a board meeting or something like that. It's as simple as clicking this button to export, and I can take that with me. Likewise, if I wanted to take this entire chat and download it, can flip it into a PDF and take that with me as well. So now we're giving you the ability to not only have your CRIO data in this really curated, modeled way where we can make decisions based on our data in real time, but you can customize the visuals as you go via Todd, pin things that are important to you, come back to it, refresh it at any point. So I've kind of zipped through this a little bit. I know we're on crunch time. I don't know if I can't tell if there's any questions in there or not, but I think we'll kind of pause there. I think there's a poll coming your way. I'm happy to answer questions now, or if you want to reach out to learn more, but certainly we'd love for you to complete the poll so we can make sure that we're getting you anything that you need and curating in future sessions the information that's most interesting to you.
Thank you, Steph. If you guys have questions, again, drop them in the chat. Feel free. And yes, please do fill out the poll. We will make sure that you get in contact with Todata's team if you'd like the resources or want to talk to someone about your site. Steph, what's the actual timeline from contract signing to getting to a working dashboard?
Yeah, that's a great question. So if it's just if you're just pulling in the CRIO data, we can move a little bit faster. There's actually a button you can click in CRIO to say, hey, share my data with Todata. And that usually takes the CRIO team about 5 business days to get us credentialed, get the information flowing over. And then we'd have a kickoff meeting where we'd meet and make sure that, everybody's on the same page about what you want populated in the tool, if you want customizations beyond just the traditional site grades model. And then for that particular data set, I mean, it's no more than 4 weeks. And that's on the long end for just the CRIO data and the site grades model.
Thank you. One thing I love about Todd is that if you do have holes in your CRIO data, maybe your site has not been always compliant in putting all of the study info in, or when you first got green lighted or whatever it may be, you can ask Todd where the holes are. At least that is a way more effective path, right, to getting
Yes.
to a holistic data set. I
Yeah.
think that's great because
Tell me all the trials that are missing enrollment goal.
Yeah.
Here's your table, export, send it to whoever is responsible for that data.
Absolutely. Yeah. Please do fill out the poll. There's multiple things that you can click there if depending on how you'd like to be communicated with. But please do fill out the poll. It helps us know how to structure sessions. It helps partners know what kind of content you guys like to see. So super important. We'd love your feedback. Thank you so much, Steph. This is great. And we will head into a short intermission and be back at 11:45 Eastern to hear from Srotas Health. So thank you so much.
Thank you.
All right, let us move on. Our next session is Srotas Health, and I'd like to introduce Vikram Parimi, co-founder and Chief Technology Officer of Srotas.
Thank you, Nikita. Very nice to meet you all, and thank you for joining. A brief introduction about Srotas. We are an AI health tech company focused on building agentic AI solutions for clinical research, covering end-to-end patient recruitment, starting from the point, feasibility, identification, recruitment management, as well as outreach, and reconciling all the information into CRIO or any other solution. So primarily, our background is technology, but heavily worked in life science and healthcare. Okay, I can. Is there any audio issue still? Or can you hear me well now again? Yeah. So primarily been working in life science and healthcare, working with the big pharma companies in developing several AI solutions for observational intervention studies, developed class 2 medical devices, and been part of clinical research where we could expedite FDA auditing using, again, AI. We also have a personal motivation to this whole journey. One of our family members had diagnosed with Hodgkin lymphoma. And at that point in time, it was really hard for us to kind of find any experimental treatments. And we started looking around, and there was not a solution that could really help us find those studies really well. So we started rolling up our sleeves. Let's try to make a difference. And we started building this solution by ourselves. And in our 4 years journey, here we are. And we would love to take you through what we have built so far. And please allow me a minute to share my screen. And here you go. I hope it's visible. Perfect. So, today's session, I'm going to cover briefly about how we use AI to connect the entire patient recruitment journey, from understanding whether a study is feasible to finding the right patients, and identifying them after you have the feasibility, engaging with them quickly, and synchronizing all of those outcomes back into CRIO. Before we dive deep into the solution bit, I would like to touch base a bit on the recruitment challenge. Today, clinical trial recruitment is often treated as a single challenge. In reality, it's 4 connected challenges. The first one starts from the study feasibility. During site selection, sponsors often ask sites to estimate how many potential patients, eligible patients, they can access. To provide a reasonable estimate, site teams must really go through their own data sources, manually review those patient records, and get back to them with numbers. As per research, about 82% of these research sites still rely on manual methods to kind of getting those numbers. But they're really not accurate numbers and accurate figures, because once the study is awarded, those feasibility estimates must become at least an actual list of potential patients. And that requires even deeper analysis. And for the deeper analysis, a clinical coordinator would spend anywhere around 40 to 90 minutes in reviewing the medical chart, which is hundreds of pages. And the complexity of this grows only by the complexity of the study. And reviewing a single patient could take a significant amount of time. And the third challenge is, how do you do the patient engagement? not every time that you would have an internal population that is sufficient to support your trial. You often rely on generating additional leads through meta campaigns, referrals, but does generating leads really solve the problem? No, it doesn't, because how quickly can you reach out to those leads? Who are the leads that I need to be prioritizing, and whom should I be following up? These are the metrics really you have to be looking after too, because 80% of the coordinator's time at sites today is spent on following up who may never meet these study requirements for you. The fourth challenge is reconciling all this information back into CRIO. When you have disconnected systems, when you're working across multiple systems, you may spend a lot of time in kind of combining disconnected journeys, manually copying information, adjusting all of this manually by yourself. So these are not four isolated problems. We believe these are one connected recruitment workflow problem, and we are trying to make a difference in that. And just to put these things into perspective across all these channels, imagine and assume a scenario of where a research center has about 1,000 patient records to review, and a reviewer taking about 90 minutes per chart equals to 1,500 hours of clinical review. That's just only the first pass of patients through your database. And assume that you have another 500 more leads through advertising and referral campaigns. And even if they spend a modest 10 minutes on the administrative burden, it will significantly increase the number of hours you're spending, about 84 hours. And all of that collectively put together, you spend 40 full-time staff weeks and approximately $40,000 spent on a single study. And sites cannot scale this because not just by reviewing more records or not just by making more calls, they need to identify the right patients early on, prioritize who the right leads are, and automate as much repetitive work as possible. And this is where Srotas Health changes the recruitment model. And how do we do that is Srotas Health brings together all these capabilities into three connected capabilities: identify, manage, and engage. These are our three agents. The Srotas IQ identify analyzes clinical data against any study protocol, structured, unstructured, including lab reports, diagnosis, and helps research teams to build and study their cohort populations and identifiable patients and do their medical chart reviews seamlessly. And once that's done, the Srotas IQ Manage, or the Manage agent, is the recruitment layer. It brings together your identified patients from the EHR, leads from meta campaigns, and any other sources that you're connected to, enables the team to prioritize all of these candidates, manage the recruitment workflow, assign actions, and stay on top of your recruitment data and recruitment journey with the help of AI. And the final bit is the engagement piece, which is in clinical grade conversational AI. It can converse with the patient in multiple different languages, 20 plus languages under 700 milliseconds latency through multi-channel voice, SMS, and email to conduct pre-screening, capture responses, and help qualified leads appointments with the site team for appropriate next steps. So these three connected capabilities help you create one continuous journey, understanding your population, identify the right patients, prioritize and engage them. And yes, of course, all of this goes back into CRIO. And one more important aspect to be really be focused upon is the data privacy and security. 85% of the practices today, which they hold the data, they're very skeptical about sharing these information with sites because sites do not conventionally hold a lot of patient data. These community practices do. And it's fundamental that these community practices are helped with how we are using AI with patient records. Because if you are sending your information to third-party LLM APIs like such as ChatGPT or Cloud APIs or OpenAI APIs, there's a concern over, okay, how my data is going to be used. So which is why Srotas Health has built its own clinical large language models with the help of 70 plus clinicians who we've been working with for the past 3 years. And we started off with oncology, and we have built our model capabilities across several therapeutic areas. And we, in fact, even published a research on how these models are developed and evaluated on medRxiv. We're very happy to send over the references. And our clinical AI can be deployed in customers' cloud environment. So patient data remains within the agreed data boundary. So this is not only important for security and governance, but also for building confidence on healthcare practices to make their patient data available for research and how it's safeguarded. Before going into the demo, I would like to talk about a few case studies that we've been working with. One of our site research networks, QCR, they had a multi-site study with respect to weight loss, and they have been working on this study for a while. They had about 729 leads, potentially through various sources, and engaged with our AI agents to kind of potentially outreach and process them. We had a 100% contact rate, and within 4 weeks of time, we were able to pre-screen 40% of those patients who are eligible for those initial pre-screening, and we booked appointments with the site team, and we achieved 30 randomizations in 4 weeks' time. This is significantly faster than what the conventional methods were. We were 6x faster and were able to achieve these randomizations. Another case study to talk about is with Renew Health Clinical Research. This is another study which was happening across multiple different sites. We had a 100% contact rate with these multi-channel outreach of ours, and we had a significant uptake in how many patients we were able to pre-screen. 46% of them through our conversational AI, like I said, SMS, emails, and voice, and we're able to randomize 10 patients in 6 weeks. So this was 7x faster than what they used to do before. So that being said, I would like to show how Srotas Health works in action. So starting from the feasibility bit. So this is our feasibility platform, which is actually accepts both free-form and protocols directly. Often sites have fragmented pieces of information spread across structured and unstructured sources, but normalizing that information is a huge pain. But Srotas IQ does it seamlessly, and I'm going to show you how it works. So imagine that I've asked a query, hey, find me type 2 diabetes patients, hypertension, obesity. It starts breaking down this request into domain modules that actually gives you all the information. Okay, I'm running against a million population now. This is live happening. And it actually analyzed, okay, type 2 diabetes, there are possibly these many expansions or synonyms that I would have clinically, and hypertension, I have so many, obesity, and all of those factors. And how it does is it basically clinically reasons all of this information and gets you back with relevant information and builds you the cohort. You have about 75,000 patients matching your cohort instantly, and you can share these numbers with sponsors directly. And it also gives you a funnel of how your cohort has been built and the distributions across, and what are the other top co-occurring conditions are, what are the other top medications are. And it doesn't just stop there. It explains you why this cohort was built and how the cohort was built. And more importantly, to maximize your cohort, it analyzes what was the context provided to it and broadens or makes recommendations. Okay, by adjusting a certain filters, you can maximize your cohort. It does all the legwork for you even before you think about it. And this is not just freeform, and you can ask multiple other queries in multiple different turns. It keeps on building the cohort for you and until you are satisfied. And you can export these results. And once the export results are there, you can directly share all of these results with sponsors to build confidence if you want. All of these are de-identified. They don't need to know any of this. And I think I've run for a really, really complex protocol. And I have all these patients. I found 32,000 patients instantaneously, which would have taken enormous amount of time to do this manually. And similar thing goes for the protocol. So where I can like just drag and drop in a protocol, our system analyzes this protocol and categorizes and classifies what can be addressed, what cannot be addressed. So there are future actions, there are future intents, such as patient should be able to give informed consent, which is not addressable. Patient should be willing to not to get pregnant. That's a future action which you cannot really determine. So all of those clinical parameters which are not going to be addressed, the system classifies them, okay, this cannot be addressed, this can be addressed, and analyzes and does the feasibility for you. And how it works smartly is it knows your data, it knows the protocol, and it reverse engineers all back together. And yeah, if I start analyzing this protocol, it starts building you, okay, what can be backed by data, what kind of data I have missing, and what do I really get to show you. And while this is happening, I would love to show another one, which is basically how you process unstructured data. So, and oftentimes when we do an outreach with patients, we would request for their medical charts externally. And reviewing their medical chart information could be a huge pain for site members. So in our system, what you have to really do is simply upload your medical chart and select to which patient that medical chart belongs to. And we have selected a matched clinical study, which has this inclusion, exclusion, and starts evaluating the eligibility of this. While this is happening, you're seeing this all instantaneously that the patient medical chart has been assessed against the clinical trial protocol, and it's giving you that, okay, this is the criteria, they have met this criteria, it's classified them, and also produced reasoning across everything. Okay, this patient is eligible because of this reason. And I can clearly view from where I have picked up my information from. So I know what my citation is. So I can confidently tell, okay, they has made a good decision. And the best part is it also highlights something as unknown. If we do not find a certain piece of information, we do not mark it as unmet and fail the patient for screening. We rather, being responsible, highlight, okay, this is the information I cannot find in the patient profile, or if there is any inconclusive evidence, that also gets highlighted in as part of this. Oh, this is also getting processed while I'm just coming back to this. So like I said, so it understands your data and breaks down the protocol in a way, okay, I can back the protocol with all the data points that I have in the protocol. This is such a large protocol, which could have taken enormous amount of time for the site teams to do it. And it also highlights, okay, these are the clinical parameters that are present in the protocol, but I cannot back them with data because you do not have them in your database. And also similarly with low data actions as well. And moving on to the next one, which is the engagement bit. So how do we get more of these results, more of the patients contacted? How do we reduce the time to contact for the patients? So, which is very, very important. So we have directly integrated with meta marketing, seamless way. You can do that by self-service yourself. All you have to do is connect your meta marketing, connect your Facebook page, connect which is your ad account, and manage all your campaigns. Okay, this is my study. This is a trial I should be mapping to, and it gets seamlessly processed. And we get to contact a patient under 10 milliseconds as soon as the lead arrives. That's the speed we are talking about.
Sorry, Vikram, we're gonna have to cut you off there, just so we can jump into our break in the next session. But thank you so, so much for presenting. We appreciate it. And the Srotas Health poll is on your screen. Please do indicate whether you'd like Vikram's team to reach out or if you'd like to receive more resources. Sorry to cut you short there, Vikram, but if you do have questions, please drop them in the chat. He'll be around to answer any if you do have them. Thank you, Vikram.
Yeah, no problem.
All right. Next, we're going to hear from Tim Brennan, VP of Health Information at BEKhealth. Feel free to take it.
Thank you. Thank you, Nikki. I appreciate it. And thanks so much for putting this on. This is kind of an interesting and fun way to interact. Bear with me just a moment. And I think you are now seeing my screen, right?
Yeah.
Okay, excellent. So again, my name is Tim Brennan. I am the Vice President of our Health IT division within BEKhealth. I am flying solo today, but I thought what I would do is introduce you to a few other players here from our organization that couldn't join me today, but if you express interest and get the opportunity to speak to other individuals from our organization, it's likely it may be one of these individuals here. So Rich Emilio is the president of our Health IT and HIM division. Dan Cook is Senior VP and responsible for our strategic partnership. So he was instrumental in developing this relationship with CRIO. And then Darren Ryder, who is our Chief Revenue Officer. We are pretty new to the CRIO partnership program. And I think, Nikki, you alluded to it earlier. I think we are the one and only right now implementation-focused partner on the list of partners right now. So I thought since we were new and kind of lesser known perhaps to the CRIO customer base, I would just do a very brief history about who we are and what we do, and then I'll get into some more specifics about our service offering as it relates to supporting implementations. So from an BEKhealth perspective, our history is primarily actually in the acute and ambulatory healthcare space. although we have been doing some work in the clinical research arena for about 5 to 6 years now. But we offer full service program and project management and data migration services, which is where our focus will be today. But in addition to that, we also support a variety of other areas within the healthcare marketplace, revenue cycle, clinical consulting, and so forth. E4Health is actually a combined organization over the course of the last 3 years. Started off as three individual and independent companies that came together in the fairly recent past, E4 Services, Intellis, and eCatalyst. And as I mentioned, it probably was around late 2020 into early 2021, we started to see some opportunities and begin doing some work in the clinical research space. And about the partnership, how it even came about. I think this is an interesting story, and it plays into why we're excited about working together with CRIO and its customer base. It actually initiated or originated through a mutual customer of ours. E4Health was contracted by a CRIO customer. They had completed their implementation. They were in a post-live mode. But they were working through a number of different post-live optimization opportunities. And really the challenge that they found themselves in was they didn't have the manpower or the expertise internally to really manage that list and drive it forward, because they had other priorities and other things that they were working on internally. Um, and we were brought in to provide that leadership, provide the ability to organize and drive and manage that specific set of priorities and get it to a point in close collaboration with CRIO and the implementation team there to get all of those things taken care of so that they would be able to move into a regular and full business as usual situation. Um, and it was really through that collaboration, I think, that both organizations realized that we had some very similar uh, concepts about what was needed in healthcare in general. We had similar cultures, and we viewed our customer successes as our successes. And it was through that sort of serendipitous mutual client that the partnership um, began and is where we are today. So let's talk a little bit about what we do as an organization and how we can potentially help you as a customer of CRIO who's facing a couple of different large, significant challenges. When I thought about where our services are most applicable to the CRIO customer base, it really boiled down to, although maybe not limited to, but boiled down to a major change event that you may be experiencing. The two more prevalent or more common type of situations that I would expect you would be considering would be if you're new to CRIO and you're about to endeavor on an implementation. Um, Fairly significant change event for your organization. It's a large scale effort, lots of management required to not only implement the solution, but also then manage internally how those changes will affect your staff and your operations. The other consideration that came to mind was mergers and acquisitions. And I'll leverage acquisitions as my example. Perhaps you're in a situation where you're acquiring some new sites. They're all sitting using either a different or perhaps several different solutions, and you need to get them transitioned onto your CRIO instance and using all of the same tools and systems that you have in place. Those are the kinds of large-scale change events that we would anticipate customers might struggle a little bit with. And I say that because it's been our experience, both in the acute and ambulatory space as well as the research space, that organizations often have limitations in terms of the number of staff that they have available to support these large-scale change events. Everybody already has a job to do. Their days are full. They are not sitting around looking for something to do. And in fact, in many circumstances, team members have multiple responsibilities. They have multiple areas in which they have accountability, and taking on the responsibility to manage the project or the program for that large scale implementation is just not something that they have the bandwidth to absorb. The other consideration is often organizations may not have that in-house project management expertise available to them. That's not necessarily the skill set that they hired as part of their standard staff to manage their operations. So they're faced with trying to find someone who can potentially step into this role, um, provide that guidance and oversight, and keep everyone aligned on goals, objectives, and executing to get the job accomplished. And then add on to that the environment in which the implementation is taking place. I mentioned before, everybody has their day job. You've got operations that need to continue on a day-to-day basis, but then you've got contractual considerations. You have timeline constraints or goals that you're intending to meet. And a big component of any large-scale investment that an organization is making is being able to realize that return on investment. And the quicker and more predictably you can complete that implementation or that transition based on an acquisition, the sooner you're able to realize the investment that you've made and then get back to day-to-day general operations. So it's challenges like that where E4 Services or E4 Health has been able to step in and provide that project management and program management support to a variety of organizations on all aspects of healthcare. We have a tried and true standard methodology and approach that we apply, establishing program governance or project governance, and that relates to identifying the individual roles that are involved, who's responsible, who are the decision makers that can address situations if there are issues or challenges that cannot be addressed within the project team, how those are escalated and to whom. We assist with the development of the project plan, which includes the identification of the full schedule, all of the tasks that need to be completed, who is responsible to complete those tasks, and ensuring that all of that information is well documented and communicated throughout the organization so that everyone remains aligned and understands their role in the entire process. We also provide support and management as it relates to issues and risks, ensuring that all of those considerations are documented, maintained, and then communicated throughout the entire complement of the project team, from the staff that's doing the individual implementation tasks and validation up through senior leadership. And all of this activity is something that is closely coordinated with the CRIO implementation team. That collaboration that we've developed with them is critical to the success of the implementation, leveraging their expertise on the features, functionalities, and configuration of the tool itself, but with us providing that support for the client to manage their side of the implementation and all of the work that they need to do to get the implementation complete and to successfully transition from that initial planning phase through go live and then transitioning all of that into business as usual activities. In addition, another key area that we can provide support relates to data migration. We have a tremendous depth of experience supporting organizations that have legacy data in systems that are either obsolete or they're moving away from. And as I mentioned before, in many circumstances may relate to an acquisition type scenario where you've got sites on a legacy platform and you need to get their information extracted, normalized, and then imported into CRIO so that they can move forward and begin using the same systems that the rest of your organization can do. We can provide a tremendous amount of support there, both in terms of both project management as well as supporting the team members in identifying the appropriate data mapping and validation exercises that they need to complete. So in a nutshell, what we're doing is providing that additional set of hands and expertise that you may not have in-house to enable your team to stay focused on not only what they need to do in normal operations, but also giving them that support to not have to worry about all of the coordination activities and documentation activities and communication activities. That's all managed by somebody from our team and allows them to stay focused on the tasks at hand to complete the implementation, get it tested, get you live, and get you realizing the benefits of that investment that you made as quickly as possible. Nikki, I will turn it over to you either for the poll or if there's any questions that come in, I'm more than happy to try to field them even while we're on the session.
Thanks, Tim. Yeah, anyone who has questions, drop them in the chat. The poll is up. Please do give us your feedback. Let us know if you'd like to hear from E4, be in the know about what they're doing, and if you'd like one of their team members to connect with you. What do you need in terms of, I guess, from the site staff that you're working with? Who are the specific roles, and like, do you have an average hours per week that are needed?
Yeah, it's a great question. Those answers really depend on a variety of different considerations. Sometimes it depends upon the size of the organization and what type of resources they have available. It will also be somewhat dependent upon what the timeline is expected for the full implementation that then translate to the number of hours per week or month or what have you that an individual may need to dedicate to the implementation. Um, a larger organization who will typically have a broader staff to pull from, they often have smaller expectations, like from a per hour perspective. Smaller organizations, it tends to be a little bit of a larger lift. But that's something that we work through during that planning phase with the organization, making sure we understand who's available, what their skill sets are, and lining up those resources to match up to what's required within the implementation so that their time is used effectively and we're supporting them throughout that entire process.
All right, moving on. Our next speaker is Alicia Moore, CEO and founder of CSRS.
Hello, everyone. If you could just give me a minute to share my screen, we can get started. Promise my presentation is going to be very short and sweet and to the point. Give me just a second. Let's see here. Okay, can you see my screen? Can you see it now?
Yes.
Okay, great. My name is Alicia Moore. Just to kind of start off, I live in Sikeston, Missouri, and our clinical research infrastructure doesn't exist. Of course, the CEO of Clinical Science Research Solutions, we are still, I feel like we're still like a baby, but we are moving right along. We became CRIO, certified CRIO partners back in November. I saw the opportunity. I've heard so much about CRIO from different resources. And whenever they came out with the partnership program, I thought, oh, this will be great, especially for an area where we live right now. Before you even get to like all the clinical sites and just getting into clinical research or into the industry, our platform or our consulting firm, we are all about education first before you move into anything else. So I'm going to be talking about how to build an AI-powered infrastructure to compete for more studies and how an accreditation, we're accredited employer, and how that can strengthen your business model and build trust within the community, and then also help you to compete for more studies. In our area, Sikeston, Missouri, let's say, for instance, rural area, a lot of times we don't have the experienced PIs. We have physicians. Most of them, we do not have what we call a private practice. Most of them are affiliated with hospitals. And then with our area, most rural areas, the clinical research infrastructure doesn't exist. So I really had to build everything from the grassroots perspective. We have our courses, and then with CRIO, having access to their sandbox will give us the opportunity to integrate that educational portion to give people the experience that they need before they even get into the research industry. And so a lot of times, again, there is such a huge lack, but you're not going to be able to compete for, well, really, you're not going to be able to approach a sponsor and say, hey, let's open up a clinical research site and we're ready to be awarded a study. It just does not work that way. So with our platform, what we're doing is we built it in a way for sponsors to be able to upload their protocol into the system. And then what will happen is our system, I'll kind of move through this kind of quickly here. Our system will actually parse that information from the protocol. And instead of just blindly reading the SIV, let's say PowerPoint presentation such as this, it's going to simulate real world case-based scenarios from that actual protocol. And it's going to be user-based friendly. So with that being said, it's going to help, whether it's a PI, your site owner, or CRC, CRA, it's going to help you actually retain that information instead of just passively reading through the protocol. And we also have it set up in a way that you're going to be graded. If you think about it, whenever you went to college, you have your classroom setting. So for us, it's education, simulation, and implementation. You can't implement anything you do not know. So with this portion here, we have our courses, and then with our AI platform, we're actually going to simulate what it's actually going to be like at a clinical research site. So again, in our area, we don't have CRC. So to get them people up and going and to understand exactly what it's like to work in these roles, you actually have to simulate what it's going to be like in the role instead of just, let's say, barely getting their education and then just getting hired on at a site. We don't do it that way. And then there's a lot of hand holding that we implement at our consulting firm for various reasons. There you see a lot of deviations happening at sites, and we will be able to reduce those deviations through our training implementation. So we're really excited about what's to come and what we're doing at CSRS. And again, with our platform, and in order to compete for more studies, having having your staff educated and well trained, you'll be able to present to the sponsor and say, hey, you know what? We've got and you've done your own feasibility in your area. And that's something else that we help with other site owners. You got your feasibility, you know the disease prevalence, and now you can actually present your case to a sponsor so you can compete for those studies. And then in areas like ours, the competition it's not there. So you are more than likely, you're going to be able to get the studies because you're not competing against, let's say, anyone that's in a metropolitan area. However, there's a conundrum there. You really don't have that experience because you are in a rural area. Well, we're here to solve that issue at CSRS. And just to kind of go back to how the training works, again, we'll have our AI system will parse that information. Of course, there's still going to be human oversight with AI. As you know, AI has a tendency to hallucinate things. So we have to make sure that it's parsing the correct information from the protocols. Then we're going to go into a role-based simulation. What is it like to actually take the information from that protocol and implement it in real life? And then from that point, once you actually have a good grip and understanding of the protocol, by the time you start recruiting patients into the study, you will be able to articulate what that protocol means in layman's terms a little bit better, because now you're able to enhance, or not just enhance, be able to break that protocol down. Because a lot of times, again, like in this area, first of all, they're going to ask you, well, what is clinical research? So can you imagine not having this type of platform, educational model, and you're in a rural area, skipping from one step to patient recruitment? Well, they don't even understand the basics of clinical research. So we have to start from the very beginning, even with our own people. And then as you are in the community explaining these things, you're going to be able to explain it in a way because now you've been tested on this knowledge or tested in our AI platform. And then at that point, the investigator, they'll be able to sign off on those training records within our system. So again, sponsors will be able to have access to see the progression of whether you're a site owner, CRC, CRA. You're going to be able to see that progression, how they're able to, they're doing, like in the classroom setting. That way, if you're ready to pick a site, you're not just picking sites blindly. And then it kind of, again, moves into this point here. You get your PIs, you get them trained, their protocol competency, you need to score at least a 90% for us. And then it's going to demonstrate, your regulatory knowledge, You're ready for the recruitment, community engagement, and just overall readiness as far as, working at a clinical research site or just working in the industry as a whole. And then also, we experienced the fact that, sponsors, CROs, they really don't know we exist in this area. So with our platform, you're going to go from unknown to known. So again, let's say like for us or some sites in Mississippi, rural areas, what we will do is we'll place you on a map, and let's see if I can. Okay, right here. So what will happen is you will be placed on a map, and then sponsors will be able to see like which sites are in the area. Let's say if you're in Southeast Missouri and what kind of workforce supply or demand that you have, they're going to be able to see like, oh, maybe this site is not quite ready yet. Maybe they don't have like all the trained staff. Maybe they don't have the CVs, the GCP compliance and things like that. They don't have it. However, sponsors will be able to see like you're actively moving towards maybe the 90%, 100%, so you can be ready to compete for studies for that area. And again, it's still a platform that's you're actually graded. So if you see a site in Southeast Missouri or Paducah with a 50% feasibility rate, well, that means they're not able to compete for studies at all. And I know we're running a little short on time. So again, with why CRIO? Well, CRIO, uh, they bring in what the ecosystem is for as eSource and the sandbox. That way we can expose it to people that are not savvy to this industry. And then CSRS, we bring in the accredited programs and we mesh the two together so we can form a stronger workforce development team and a site. So at that point, you're going from a site that's not even known to a site that's going to be ready to compete for studies. And then you're going to have a stronger workforce development so we can be successful at recruiting and retaining our patients at the clinical research sites. So again, this was very short and sweet and to the point. If you have any questions, you can email us. And if you have any questions, please let me know in the chat. And I'm sure there's going to be the last poll for the session today.
Thank you, Alicia. Yes,
You're
please
welcome.
do complete the poll on screen to let us know if you'd like Alicia's team to reach out to you or if you want any resources on CSRS's organization. I'll leave it up for a few seconds. And then if you have questions, please do drop them in the chat. All right. I am going to launch our feedback survey. Please, 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 we'd love your feedback on how the expo went for you and how we can make things better for next year. We read all of your feedback and it would mean a lot if you could just fill it out. Just takes 20 seconds. Please, like I said, don't leave. I'll just take 2 more minutes of your time. You're going to want to hear the end. I have a few really great ways that you can connect with partners and what to do next with all of this great information that you now have. But congrats, we made it. 4 days, 4 tracks, 22 partners. Before anything else, thank you so much for showing up, staying engaged. A huge thank you to every single one of our presenting partners this week. Those who just joined us today, BEK, Todata, Srotas, BEKhealth, and CSRS. Thank you guys for a great action-packed day, and the others across the last 4 days who showed up ready to teach, not just pitch, and give us focused content. That distinction really matters. But before you go, here's something I want you to walk away with. CRIO is clearly more than just an eClinical platform. It's a platform plus an ecosystem of the best vetted vendors in this space, built specifically so your site can run smarter, tighter, more compliant, and enroll more patients without you having to do that vendor research yourself, which can take months on end. That was truly the whole point of what we built this week on. Whether you came in looking to fix a specific gap right now, or you were just here to know what's in the site tech world and the site provider world, you are hopefully leaving with a short list, real vendors already vetted and proven with CRIO sites. So now, what do you actually do with that? Let me give you three things, three ways that you can apply this information. And again, we'd love your feedback on how we can make this more effective for you next year. Okay, so first, again, please take the survey 20 seconds. If you do have comments on the structure, or maybe you want to see different partners next year, or you'd like different categories, or you'd like the agenda to be a different way that would be more effective for you, please let us know. We want to know all of that so we can make this an effective event for you and a great resource. So please, it is not a formality. It is truly how we decide who gets invited back, how we structure this whole thing. Second, please go connect with these partners. If you're already a CRIO site, feel free to log into your CRIO instance and then just head to the Help Center and hit that partner directory. There's a Contact Us button. All of these partners you saw this week are in that directory. So easy, just click Contact Us. And if you're not a CRIO user, you can just head to the partners page on our website. The URL is there on screen under Not Yet on CRIO. That has all of our partner websites, and you can easily connect with them there. Third, if you missed a session or you're watching this on YouTube, you want to rewatch, send it to any of your colleagues who couldn't make it. Again, like I said, every single Expo session is going up on our YouTube channel. You'll all get an email with the link to the recordings later today. You should be, if you joined us the past few days, you should already be getting those emails. If not, reach out to crio.partners@clinicalresearch.io or just head to the CRIO YouTube channel. So they're all available. There's no excuse for anyone who's on your team not to see this if you found something interesting. But that is it. That's everything I've got for you. This week is exactly why I love doing this job, getting to put the best people in this space in front of the sites who really need them and watching those connections actually happen in real time. So thank you guys so much for being part of it. I'm Nikki. This has been the 2026 CRIO Partner Expo. Go fill out that survey, please. Go meet your partners, and I will see you next year. Thanks, everyone.